My name is Dr. Jordan Tishler. I run a practice called Inhale MD. My background is a fairly traditional background. I went to Harvard College, I went to Harvard Medical School, I trained at the Brigham and Women's Hospital in internal medicine, and I've spent the last 15 or so years working as an emergency physician at the VA. So, I've taken care of very sick, hardcore cases for a very long time, and I've seen a lot of damage from substances over the years, and yet never from cannabis, and that's sort of what stimulated my thinking about getting into using this medically. And a consequence of this loose approach that's sort of become the national model is that physicians aren't training themselves and they aren't being able to give the advice that patients need. If you went to the doctor for high blood pressure and the doctor said, "Yep, you got high blood pressure, go get some medicine," you'd look at them like they had three heads, right? You'd be like, what medicine? How much? When do I take it? What's it going to do to me? What are the side effects? All those sorts of things. I think that it's vastly important that we treat cannabis the same way. I will spend an hour sitting with a patient talking just about their illness and cannabis. There's no way you can shoehorn what I have to tell patients into a primary care visit along with everything else. So it really puts primary care providers in a very awkward and uncomfortable position. So a lot of what I did was I started my practice as a way to be a specialist, as a consultant for all of my colleagues who they don't have a problem with cannabis as medicine, they just have a problem with the fact that they don't know how to deal with it and they don't have the time to deal with it. They need some place to refer, and that's been very successful.